all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're opened by Barb Bobula, who is the VP of Patient Experience at Allegheny Health Network, and Dr. Gene Scioscia, who is the Chief Patient Experience Officer at Allegheny Health Network. Thank you both for being here.
Thank you.
Thanks for having us.
We just had an amazing conversation about how AHN is incorporating love and compassion and empathy into getting better outcomes for everybody involved, from the patients to the providers. And so we are doing our one question segment. Apoorv, you're up. Take it away.
Sure. Yeah. Thank you. I was riveted by the conversation, Barb and Gene. And really, there was something at one point, Barb, what you brought up when you were talking about some of the stories. We were talking about the day-to-day of compassion and how and you mentioned that, you know what, this is happening in all of our health centers. So that really perked my interest because it is happening. And when you go into the health centers and you ask them, they'll tell you the same stories. But yet at the same time, you folks have put in so much energy into creating a new culture and a new approach, which is boldly pushing forward on the basis of love. So I guess my question out of that is there a point at which you realized that something was changing within Allegheny Health Network, that you could sense that the culture was changing? Is there a way that you know that you are doing something a little bit different, a little bit special, that's building towards something more so than what might happen at just another medical center?
We always look for evidence and we always have to show impact. So not only are our CAP scores, our patient, experience scores going up, which we've seen a lot of great improvement with a lot of people working hard in that direction. That's one of the evidence things, but we have a submission form on our website for compliments, and those have shot through the roof. I can tell you, we have received so many compliments coming through that way. People are going out of their way to find a way to give those compliments, both to, providers, staff, people, but we've also seen an increase in sharing that information in our organization. So I would say when I started on this team, 6 years ago, that might have come straight to the patient experience team from a patient, but now we have leaders circulating that information and sharing it. And I think that's also evidence of our culture shifting towards recognizing that this is important, like calling that out and, rewarding that and recognizing it is important. We will have leaders share, a story from a staff person with high level leaders, and everyone's on board for recognizing that person. So I think those are all, points of, to me, that we are seeing a change. And also I hear when I'm interviewing candidates that they want to come work here because they know we're we have a competitor in our market that's known for their research and science-based, and they say they want to come work for us because they know we care about people here. And that's a huge compliment. That's a huge compliment because it's, not just a competitive advantage, but it means something to me that we are creating an environment where people are recognizing that. And that's the word on the street, is that we're the ones that really care about people. So those are all, to me, points that show it.
6 weeks ago, I was asked by one of my those that I report to report to the board and talk to them about the value of patient experience to a board of directors, many of which are lay people, non-clinical. And it was a pleasure to be able, now that we had enough data and research and understood it, to show literally the revenue stream created by having a truly ideal patient experience. For literally the money that's associated with these CAP scores we talk about, but also patient loyalty and how that translates to, and though I dare say it, how you might be avoiding things like liability issues because of your enhanced communication skills and your relationship with the patients who otherwise might have misunderstood. These are all values that you bring to an organization. And when we start talking about the transition in healthcare and the paradigm shift to a value-based system, it's a pleasure to be able to introduce those subjects and show that's the value patient experience brings to the organization.
With that, the results that you just said, both, the bottom line and in the clinical setting, what is the one thing you would tell providers, nurses, doctors, anybody to start, whether they feel like they can't do it, they don't have the empathy that day? Where do you start? What's the one way to stoke that fire?
If I'm talking to providers, they want data. So I would do your research. Barb will tell you, I read incessantly, and I got the facts before I went into the room, because I could anticipate some of the questions and some of the challenges. Very professional, very respectful. They're going to challenge this because many people translate patient experience into time commitment. And is it going to compromise my efficiency and my productivity if I start being this compassionate, empathic person? And we had to show them data. Not only will it not, it'll actually make you more efficient. And we had to show them whose time are you measuring, besides just your own time, your colleagues' time, the emergency room's time, the patient's time. You need to text them back again, but you need to explain things the right way. So time is money. Well, let me explain to you how this translates into efficiency for you. That was critical.
Thank you so much. This was amazing. We really love talking to you both.
Yeah. Thank
Thank you.
Thank you so much. Bye-bye.
Thank you all for watching. Bye-bye.
you.